Hello, today I'm going to be showing you all the things that I have in my personal first aid kit, and I'm also going to briefly explain why I have each thing in there. I'm going to start by showing you the container that I've chosen to store the supplies into. I have this bucket right here. It is just a container. It has a sealed lid on top. The lid snaps on both sides. This is going to help to make sure that all of the supplies inside stays nice and dry. It's also going to help me carry it onto a site with little difficulty because it is so compact. I'm now going to open it up and I'm going to just show every single thing that I have in here and tell you why I've chosen to put it in there. I'm going to start with a notebook, and I also have a Sharpie attached to it. Now this may be something that you weren't expecting me to say that I have, but it is very important because everything that I see, everything that I observe, all the questions that I ask, the answers to them, they should all be written down in here. And that way, once the patient leaves my care to go on to further care, they will know everything that I've seen and asked because it could be essential. Next, I have a lighter. This would help me light a fire, hopefully with little difficulty because I'm not very woodsy, but if I needed to have a fire to help even keep someone warm, I would have it, and that would prove to be useful. Next, I have some scissors. You never know what you're going to need scissors for, to cut clothes off of someone, to cut any material into some type of bandage or sling that I could use, like such as triangle bandage. I would have scissors to be able to do that. Next, I have some zip ties. Now, I've chosen the ones in bright colors just because it'd be easier to see from a distance, but also I was thinking that each color could be used to identify something, and I could write down what each color means in my notebook. Next, I have some self-adhering tape. This is very nice because it does stick to itself, so in wrapping a wound, I wouldn't need additional tape or anything like that because it would stay onto the person. Also, while putting compression on whatever wound they have. Next, I have some low-dose chewable aspirin. Now, I would assume that you would need aspirin in your first aid kit, but this specifically, since it is low dose and also chewable, it would work for a multitude of different people, younger children who cannot take a strong dose, but also those who are not willing to swallow a pill. So, in all circumstances, this would be useful. Next, I have this. It is it's just a material. It goes out. Currently I have it rolled up, but it has a Velcro on each side, so you could wrap it around someone. It's called an ace bandage. Oh God. Say hi to my dog, excuse me, I'm sorry. But this is an ace bandage, and it would help put compression onto a wound. It can also help you hold gauze onto an injury that you started putting down once bleeding occurred. So this is also very useful. Next, I have an emergency blanket. This is a little different. I wouldn't have originally thought to put this in here, but if it's cold outside and your patient is experiencing even hypothermia, you can put this on them and it'll attract the heat from the sun, and the material will help warm the person up. But also, you could help a patient stay dry with this, since it is that specific material. Putting it on them would keep them away from the rain. Next, I have gauze pads. Now, these specifically are 4" by 4", but you can get a multitude of different sizes, as I learned while trying to shop for these, but they're soft, they're absorbent, they will help you soak up any type of blood or any other bodily fluid. When trying to stop the bleeding, you can start putting them down on the patient as you put compression down, and hopefully that would be enough to stop the bleeding from an injury, since we know bleeding is one of the most deadliest things when responding to an accident. Next, I have aloe vera. Typically, this was in my first aid kit already just for sunburns, but it can also be used on other types of more serious burns by electricity or really anything. So this is just a smart thing to have in there to help try and smooth and moisturize the skin. Okay, next, I have an emergency poncho. This is also of the purpose of trying to keep someone dry, especially in emergent situations. You may not realize how deadly rain can be, as crazy as that sounds, because it can, contribute to the injury. So just keeping everyone dry, including myself, the supplies is very important. Okay, next I have some Allegra. This is allergy medication. This would not work for someone who is in anaphylactic shock because it does not work that quickly, but it could be very useful for someone with seasonal allergies. That's something that I have trouble with, so I like to keep this in my bag, especially now since it is spring. Next, I have a flashlight. This is still in the container. It also has 4 additional batteries, just in case, but accidents do not always happen when we would like them to, when the weather is good, when it's daytime. So if you are responding to an incident where you're in the dark, you're gonna need to be able to see. So a flashlight would again be useful. Okay, next, I have this variety pack of Band-Aids. Now, I just picked this up because it has so many different sizes included in it. So, depending on the injury, how big it is, where it's located, there should be a Band-Aid in here that would work for your situation. Okay, next I have an inhaler. Now, this was personally prescribed to me. And of course, ideally, I would like to use a person's inhaler that was prescribed to them, just because that is the safest route to go always. But in matter of life and death situations, that's not always going to be something that we have. So in a situation like that, I would have it on hand, but also for me, since it is mine, I suppose. Next, I have roller gauze. This one that I have particularly is 3 inches, but 3 inches wide, of course. But this is very nice because it's very soft, it's stretchy. Again, it would help you in wrapping a wound. This could also be useful to hold down other gauze. This is very absorbent. This would help with bleeding, just along with the other gauze that I've already showed. Next, I have instant cold packs. Now, these are very cool because you shake them and they will immediately turn very cold. Ice can be useful in injuries for, even breaks and sprains, but less severe things. But often you don't have ice just on hand. So this would be very useful because it is instant and it would be to my disposal. When things are amputated, also in more severe conditions, of course, that amputated limb or finger, whatever it is, needs to be kept cold. So I could also use that in a situation. Okay. Now these two things kind of go hand in hand. I have hand sanitizer and I also have alcohol prep pads. Now, since both of these things contain alcohol, we know that alcohol is very essential in trying to kill germs. When trying to care for someone, we want to avoid infection to the best of our ability. So these are very, they're very good things for that first step of trying to prevent infection. The hand sanitizer would go on my hands, of course, before I put on gloves. And the alcohol prep pads, I would wipe down any type of injury before I started putting a Band-Aid on it or ointment or anything else like that. Okay. Speaking of being sanitary, this is perfect. The next thing I have is my gloves, examination gloves. I would put these on before assessing the patient to protect myself, but also them. That would be a good first step in really any type of physical assessment. Okay, next I'm going to have some tweezers. Mine are pretty cool. They have this little light that you can shine on them just to see things more clearly as you're trying to pull any object out of a patient. Tweezers are nice because, once again, it does reduce infection since I'm not using my own fingers, but you can also be more precise in what you're trying to grab. Okay. I have trash bags. I have a couple here. They are kitchen size. I just grabbed them from my kitchen. I folded them up. And these are useful for one, of course, throwing away trash, but also keeping a patient dry, or something that you could lay out and then put your supplies on top of it to try and keep things clean. There really is just a number of different uses for these. Kind of along the same lines, I do have a couple of Ziploc bags. Mine are freezer size. These could be useful for also throwing away things. I would say like anything that needed to be disposed of like properly and aside from other trash like spoiled things from blood or needles. All of those things need to be disposed of differently than your everyday typical trash, so they need to be kept separate. So I would put them in here. All right. Couple of things left. Next, I'm going to have this hydrocortisone cream. It's anti-itch cream. This would be very useful for any type of bug bite or rash, even mosquito bites. This is always my go-to to put it on there really quick. It's simple, it's easy, and it provides relief. Okay, this is my pocket mask. This would go around the face of someone who I was administering CPR to. Hand-to-hand CPR is effective, but it's even more effective when you are able to administer breaths, and I can only do that safely with this pocket mask because it protects me. It also protects the patient. We don't want things, transpiring between the two of us. Okay, next I have safety pins. This could help you hold any type of bandage onto the patient. They're also pokey if you need something like that, something sharp. Next and final, I have a whistle. Mine is bright orange. I am not a very loud yeller. I can't speak very loudly. So to get the attention of someone, this would work very well. You blow it and people would start looking your way. So that is everything that I have in my first aid kit. I will put everything back into here, and along with the lid, of course, and I will probably put that in my car so that I always have it on hand. It can be very hard to prepare for an emergent situation because you never know exactly what you're going to need, but hopefully this would work in a number of scenarios. Thank you.